The RMNCAH scorecard was established in 2017, and its use brought together different stakeholders, amongst them the development partners, program staff, as well as district representatives. Since its establishment, the scorecard has been seen as a useful tool by the various RMNCAH-related programs like vaccination, family planning, immunization, community health programs, and so on.
The way the scorecard is designed, you can see where you are performing well, it is in green. Where you are in progress but you need additional effort, it is in yellow. Where really you are behind, it is in red. Then it became more easy to know where you should put emphasis, coming with additional resources being human resources, financial resources, mobilization of partners, engagement of community. I think it's a good tool which can help us to track our progress day to day.
Periodically, different meetings are organized within different forums to see the progress achieved and thus make the necessary decisions.
The coordination meetings brings together stakeholders from health centers, and we can also invite the health post managers and representative of community health workers, because part of what we discuss in the coordination meetings is the work of community health workers.
So it will be a tool for discussion in district management meeting, but also it will be a tool for advocacy to the district administrative, because they'll be showing the trend of those different indicators and action that have been taken and the status of implementation.
In the community family planning strategy, the health centers officers benefit from the big help offered by the community health workers. We do door-to-door mobilization where we sensitize pregnant women to make the first antenatal visit in the first 3 months of pregnancy. And we tell them to think about family planning already. After giving them the starting method, the health center sends them back to us in the villages where we continue to monitor them. The advantage for us is that we are going to analyze the data ourselves and make decisions based on that information. If we encounter a problem, we will be able to set up goals that can help us solve it. Thanks to the scorecard, the Ministry of Health and the Rwanda Biomedical Center, we are able to adopt strategies to improve the lives of women and children, to reduce infant mortality, and above all, to strengthen family planning. The capacity of health centers has been strengthened by the qualified staff and the equipment needed for different family planning methods.
With implementation of scorecard, decentralized down to the lowest level, is going to help to really understand the real problems, have the appropriate actions or activities, and then have a good plan and the decision making. Here, a scorecard now will come in one, to harmonize data collection, to harmonize monitoring of programs, but also to harmonize the reporting to guide on which improvements do we make to make a difference.
All this will help us to improve on the delivery of the interventions, for improving policy direction, for strategic planning, and ensuring that we deliver quality services to the women, children, adolescents, and the population at large.
The scorecard has shown itself to be a tool that facilitates the evaluation of what has already been done and the use of resources at all levels. In general, the Ministry of Health is satisfied with the results achieved thanks to the scorecard, and there is much greater hope for progress to be made in the days to come.